If you have joint pain and some rashes, or if your doctor ordered a series of autoimmune blood tests, now you might wonder, what is your diagnosis? Is this lupus or is this rheumatoid arthritis? How can you tell the difference? In this video, I will explain to you the signs and symptoms of two of the most common autoimmune diseases that I see in my practice rheumatologist on call, rheumatoid arthritis and lupus. And I will answer you the most common questions that many people that come to me or people in my YouTube community will ask. What is lupus and what is rheumatoid arthritis? What are the most common signs and symptoms? And how are they similar? But also, how are they different? And can they exist together? Yes, these two diseases, rheumatoid arthritis and lupus, can come together and can overlap in signs and symptoms. Let's begin.
RheumatologistOnCall.com.
Rheumatoid arthritis and lupus are both autoimmune diseases, which means that your body immune system mistakenly attacks its own tissues. While rheumatoid arthritis primarily affects the joints, lupus can attack multiple organs, including the joints. Over 1.4 million Americans are estimated to suffer from rheumatoid arthritis, while 1.5 million of people suffer from lupus. In both of these diseases, women of childbearing age are more affected. Lupus, the most common signs and symptoms. Lupus is a systemic disease, meaning that it can affect various parts of the body, various organs, from joints and muscles to skin and even your brain. Let's learn more about the most common signs of lupus. Butterfly-shaped facial rash. This type of rash will be disposed over the bridge of the nose and over your cheeks, but something that is unique, it will not cross the nasolabial folds. There are also other forms of skin rashes that can happen in people with lupus, from cutaneous subacute lupus to scarring lesions like the discoid lupus. Photosensitivity. This refers to the increased skin sensitivity to the sun exposure. That means that people with lupus will burn out very easily when they get exposed to sunlight. Oral ulcerations. Now these are sores in the mouth that are usually not painful, but they can also be painful, and they are seen in patients with active lupus disease. Joint pain and swelling. Now this usually affects the small joints of the hands, but it may also affect other joints, like, for example, the shoulders, the knees, the hips, or ankles. The joints can be red, swollen, and painful, and people with lupus will describe difficulties to use their hands and significant morning stiffness that usually lasts more than 1 hour, but it will improve with movement. Fatigue and fever. People with lupus can present with low-grade fever, usually at nighttime, accompanied by this feeling of they are not well, they are tired, they are fatigued. Fever can be a sign of inflammation, but can be also a sign of underlying infection. Chest pain and shortness of breath. Patients with lupus may complain of chest pain, especially when they are taking a deep breath. They often have to stop taking deep breaths because of chest pain. This can be a sign of inflammation of the lining of the heart or the lungs, but it can also be a sign that there is fluid in the lungs or around the heart. Unfortunately, patients with lupus are at high risk for heart attacks, so it's best for you to check your heart immediately if you experience chest pain and you know that you have lupus. Kidney involvement. Patients with lupus can sometimes develop kidney inflammation, which can lead to serious consequences. Changes in the urine color, like it becomes red, frothy, or bubbly urine, can indicate that lupus might affect your kidneys. Once again, this is a serious complication and requires quick evaluation and treatment because the risk is to lose your kidneys. Neurological symptoms. The peripheral and central nervous system can be equally affected by lupus. That means that patients with lupus can have headaches, seizures, loss of consciousness, inflammation of the spine, and even tingling and numbness in their hands and feet. Now let me tell you the story of one of my patients. He was a 24-year-old, very active black man who 4 weeks before the admission that I saw him, he was evaluated a few times in the emergency room. The first time, he presented there with leg pain, and after a few tests, he was diagnosed with a blood clot. He was treated and sent home on medication. 1 week later, he returned to the hospital for shortness of breath, and this time he was diagnosed with possible pneumonia. He was treated with antibiotics and again sent home. Then 2 weeks after this episode of pneumonia, he lost his consciousness and he was brought to the hospital by his parents. This time, he was admitted in the intensive care unit, where one of my residents thought that this young gentleman might have some mysterious autoimmune disease. To everyone's surprise, the test came back suggesting that this young patient had an autoimmune disease, and then they consulted rheumatology. Based on my evaluation, I was able to diagnose the patient with lupus that was involving his brain. Luckily, with his parents' agreement, we started treatment quickly, and that saved the patient's life. Today, the patient is back to normal life, and he was very grateful that he received the correct diagnosis and treatment in time. If you see this video, you know that you are my patient. I would like to salute you and congratulate you for all your efforts to recover. This case was actually published and it took the first page of one of the most respected journals of rheumatology. Hair loss and alopecia. Some patients with lupus can develop diffuse hair loss or thinning, while others can lose hair in patches that is called alopecia. Blood count changes. Patients with lupus can present with low blood counts, from anemia to low white blood cells and even low platelets. And this can indicate that certain antibodies are attacking the blood cells and they are actively destroying them. Now, rheumatoid arthritis signs and symptoms. Let me remind you about rheumatoid arthritis. If you watch my channel, you know that rheumatoid arthritis is my passion. You will find many videos on my YouTube channel that are discussing this topic. So if you want to learn more, please watch my videos. The most common signs and symptoms of rheumatoid arthritis are joint pain that can affect primarily the hands and feet, but can also affect many other joints like wrists, elbows, shoulders, hips, knees, and ankles. The pain and swelling is symmetrical and bilateral. Mornings are the hardest for many of my patients with rheumatoid arthritis because that stiffness lasts for more than 1 hour, but it will improve with movement. Rheumatoid arthritis can affect other organs like the eyes, causing dryness, the heart and the lungs, causing shortness of breath, or it can affect the skin, causing rashes and nodules that we call rheumatoid nodules, but can also affect the blood counts. For example, it can cause anemia or low white blood cells. Similarities between rheumatoid arthritis and lupus. As you can see, rheumatoid arthritis and lupus can look similar as they both affect the joints, the skin, the lungs, and even the blood counts. For people that are not trained to understand these diseases, this can be very confusing. Differences between rheumatoid arthritis and lupus. So what are the major differences between rheumatoid arthritis and lupus? Let me go over a few of them. Number one, symptoms. Lupus tends to affect more the skin, causing the butterfly rash and the increased sensitivity to the sun, together with the joints, while rheumatoid arthritis tends to start more with the joint pain, the swelling, and the stiffness. Now, the swelling of the joints in rheumatoid arthritis tends to be more prominent than in patients with lupus. Number two, the aggressiveness towards the joints. Lupus can cause inflammation but will not destroy the joints and does not cause erosions in the bones. Lupus may cause deformities in the joints like Jacquard arthropathy, but these deformities are reversible when the fingers are passively moved, which will distinguish that from deformities seen in rheumatoid arthritis. In contrary, rheumatoid arthritis affects the joints, and if you let it untreated, will destroy the joints and will cause erosions and permanent deformities. Laboratory test. Now, another difference is the laboratory test. There are specific laboratory tests for lupus, like different types of antibodies from ANA, double-stranded DNA, anti-Smith, SSA, SSB, RNP, just to name a few, along with complement level that may be decreased. For rheumatoid arthritis, the rheumatoid factor and anti-CCP antibodies are usually the laboratory that we look for, and they are present in 60 to 70% of patients. Some patients with rheumatoid arthritis may also have positive ANA, but usually they do not have the other autoantibodies from lupus to be positive. Now, treatment. The treatment for rheumatoid arthritis and lupus is completely different, and that is why it's very important to have a correct diagnosis. Can lupus and rheumatoid arthritis come together? Yes, both of these diseases can come together. Actually, there is a name for that combination that we call rupus. There are patients who have many signs and symptoms of lupus, like skin rashes, oral ulcerations, chest pain, shortness of breath, plus they have an aggressive form of arthritis that can cause erosions to the bones and can cause joint deformities. These patients usually have a positive rheumatoid factor and anti-CCP antibodies together with other autoantibodies present in lupus. That is why, even in patients with lupus, I do order the test for rheumatoid arthritis. How to find help for rheumatoid arthritis or lupus when you need it the most? As you probably experience, being in pain due to rheumatoid arthritis or lupus is not only unpleasant, but can be rather dangerous. In our days, there are so many hurdles to get to see a specialist, especially a rheumatologist, who has been trained for many years to recognize, diagnose, and treat these autoimmune diseases. Here in the United States, the average waiting time to see a rheumatologist is between 4 and 6 months. This is critically important, especially for patients who suffer from lupus, as 6 months is enough time to lose the battle with lupus. In 6 months, you can develop severe heart disease, severe lung disease, and you can even lose your kidneys. So waiting is unacceptable. The damage that can happen in 6 months cannot be reversed. That is why I started my company, Rheumatologist on Call, to help people in need when they need it the most, now and not in 6 months, to see people who, for many reasons, they cannot see a specialist because they are unable to travel, or because they don't have a rheumatologist in their area, or because the waiting time is too long. My company actively sees through online consultations patients in multiple US states. We have also seen patients worldwide who needed our help to sort out the diagnosis and in this way receive a second opinion. We help people from the comfort of their homes. No need to travel or wait in a waiting room for many hours. No need to suffer. Not only that, but we do not discriminate based on your insurance, and we do not delay your care because your insurance is not on our panel. My company offers truly affordable pricing and transparency of all costs. We are here to help people when they need it the most, not in 6 months. If you need our help, do not hesitate to contact us. If you know someone struggling to see a specialist, a rheumatologist, or you need a rheumatologist who will take excellent care, check out our website and schedule an appointment. Please do not forget to subscribe, give a like, or just leave me your comments in the bottom of this video. I truly appreciate your support for my educational efforts. Thank you for joining me, and I will see you soon.
RheumatologistOnCall.com